Then we now have the Jagabans. This set of people.
Stunt refuser.
These are the ones that have refused totally to take vaccine.
So the moment you do not take vaccines as at when due, the thing is that you're most likely to fall ill to all these preventable diseases that the vaccines were created or produced to prevent.
Yeah.
Yes. And not only will you fall ill, you put your family members and people who are in proximity to you at risk of having these infections.
One thing that struck me in your statement now is that the fact that it has an economic effect on countries.
Of course.
So you mean the country now has to spend so much
Exactly.
on people like me.
Exactly.
Or stubborn people like you.
Because the thing is that people like you are not just people like you. There are multiple people like you. It's the compound power of one.
Why are you feeling attacked?
No. I don't feel attacked. I just feel burdened. It's different.
Right.
Yeah. So it's a lot to unpack. Like that word trust.
Yes.
Because the thing about trust is that it's earned. And then when it's lost, you have to do a lot more to earn it. Yes.
Yeah.
And that's just coming off of relationships. Now, coming off of healthcare that can affect not just individuals, but communities and nations. There's a lot that we've not been able to do, but we are learning.
I'm ready. Just shoot me. I don't mind.
It's not true. It's BS.
Hey guys, this is Timeline. My name is Paul. Other people and with me here is
John, Eze.
I have a very beautiful guest in the house with the name.
My name is Dr. Blessing Eshet.
Welcome, Dr. Blessing.
Thank you for having me.
It's good to have you in the building.
Yeah, welcome.
So now let's get at it. Today we're talking about a very interesting and controversial topic with vaccine hesitancy. It might be very interesting and very controversial, right? But today we're going to talk about the real things, look into even in-depth of stats, talk about things that affect the world and also here in Nigeria. But it might shock you that one out of 5 children, according to WHO, do not get vaccinated at when due. This, at the end of the day, costs about 1.5 million children death year in, year out.
Yeah.
Indeed, it's sad, I must say.
Very, very sad. And I'm sure that we'll be wondering what vaccine hesitancy is. So I have a definition for you guys from WHO, that is the World Health Organization Strategic Advisory Group of Experts, SAGE. They define vaccine hesitancy as a delay or a refusal of vaccination despite availability of vaccination services. This means that they are saying no, people don't want to take vaccine even though there are vaccination services. And this brings me to the 3 types of people that we have. First, we have people that they might want to take the vaccine after you've persuaded them, like encouraged them, or you've done some sensitization. They will not be like, okay, let me take the vaccine. And we have this set of people that they'll be like, they will delay in taking the vaccine.
Yes.
Yeah. Like, for instance, let's say there's a particular outbreak.
They're not so sure about it. So they are just watching
they're
other
waiting.
people. They're waiting for their friends to go take the vaccine first.
Exactly.
Come back and let them know how it goes.
Yeah.
Then
So
they'll go.
they will now they will now delay. So maybe after some time, they'll now be like, okay, since everybody have taken it, okay, let me just go.
Yeah.
Then we now have the Jagabans. This set of people.
Stunt refuser.
That's the word.
I don't even know what to call them. They will now say, okay, no matter the kind of outbreak, whether rain come, sunshine,
Move
anything,
for
I'm not taking.
These are
the ones that have refused. These are the ones that have refused totally to take vaccine.
Yes.
Yeah.
I don't really understand it. And obviously, we have a lot of things that have happened. So now to you, Dr. Blessing, as a doctor, what are those effects that can occur in people like that have refused to take vaccines?
Okay, so thank you for your question. And I take that to mean that you're asking for the impact of not taking vaccines.
Exactly.
We're going to begin with the individual first. So the moment you do not take vaccines as at when due, the thing is that you're most likely to fall ill to all these preventable diseases that the vaccines were created or produced to prevent.
Yeah.
Yes. And not only will you fall ill, you put your family members and people who are in proximity to you at risk of having these infections. And then in the case of a family or even as an individual, when you fall ill, it means that you have to bear the brunt of your healthcare.
True
So,
that.
for instance, if let's say I'm a mom and I was supposed to have given my child all the vaccines, the childhood
measles,
vaccines,
Yeah.
and then I
polio.
miss them. My child comes down with measles or stuff like that. I'm the one who goes to the hospital, who pays the bills, who sits up at night all through the night, mopping my
Exactly.
child's brow, and
Yeah.
I'm wondering how my child is going to recover. And then there's also a low quality of life because for illnesses like measles and polio, they have like sequelae that follow the whole event. So people can come back with paralysis. People can come back with deafness and stuff that they probably would not have
deafness.
had. Yeah,
Yes.
like for measles virus, yes. So like, different things that would not have happened to you if you didn't fall ill in the first place. And that's just how about now we're in a global world now, want to travel. My sister, if you don't have your yellow card and other things, the corona virus vaccine,
now.
you
You've been
cannot cross
restricted.
borders as you should be able to. And that's not the only thing. Now, some studies that came out of the US showed that they spent so much money. It cost their economy about, I think, $1.3 billion. I think that was about in 2010s or 2015s. Like, I'm not really sure right now. So just to pay for illnesses that could have been prevented.
Wow.
If those people are taking vaccines. So it's a huge economic burden to your nation. And then, like I said, we travel a lot. So we're taking illnesses from one border to the other. So we're also increasing the global health burden of diseases by not vaccinating.
So one thing that struck me in your statement now is that the fact that it has an economic effect on countries.
Of course.
So you mean that? So for me now, being stubborn that okay, I don't want to take the vaccine. It's possible that the country now has to spend so much
Exactly.
on people like me.
Exactly.
Oh,
Interesting.
stubborn people like
Because
you.
the thing is that people like you are not just people like you. There are
yeah.
multiple people like you. It's the compound power of one. So there are many
Interesting.
people like you who are going to affect the economy.
Okay,
Yes.
so according to UNICEF, right, some 25 million children are now missing out on life-saving vaccines. This is like to correspond with what you said. Every year, placing them at risk of preventable diseases like measles and pertussis. The most poor and marginalized children, often most in need of vaccines, continue to be the least likely to get them. Like, this is really, really not funny, like from the UNICEF. This is reporting from UNICEF. Yeah.
So how do we get vaccines to all of these children that don't even have the access to it? There's one of not wanting to take the vaccines, but this one I feel like they're ready to take the vaccines, but unfortunately they don't have the access to get the
Okay,
vaccine.
so it's not as simple as you make it seem. So yes, there are people who want to take the vaccine and who may not have access to it, and that's true.
Yeah.
But then there are communities where they don't even know about a vaccine or
Interesting.
vaccines. And then there are communities where they know about this, but they don't trust
The
the
system.
vaccine, the source, like you said, the system.
Yeah.
So like I saw some studies on HPV vaccine acceptance, and it showed that it's more in the South, especially among Igbos and Christians, than in the North and in the Southwest, where there's predominant, and this is not to slight any religion,
Yeah.
right, or anything, but it's just that sometimes in different communities, they don't really listen to you coming as a health worker.
Yes.
They listen more to their community leaders. They listen to their religious leaders.
Wow.
Those are the people they see. They may not
see
have
them as the-
exactly.
So,
all knowing.
if the religious leaders don't take the advice of the health
Healthcare
workers,
workers.
that's the end of it.
we have to include them as vaccine champions. Yes.
They have to be at the forefront of this particular
Thank
work.
Thank you.
But again, let's try to go back again and trace history back.
Yeah.
These things started from somewhere, and I know of the 1955 incidents of the Qatar incidents where
Yeah.
vaccines that were meant to go prevent polio
Had the live vaccines.
exactly had the
Live
live
virus.
vaccine
Yeah.
virus in them,
Yes.
and then it's increased number of cases. I think of about 400,000 cases, and then at the end of the day, hundreds of children were paralyzed, and then lead to about 10 deaths. However, it was found out that there was different mishap with the preparation of that particular vaccine. And it's very interesting because at the end of the day, all of these vaccines were called back, and just to ensure that this doesn't happen again. And again, I know that the owner of the Qatar lab was so sure of his vaccine that he even gave his own children first, like those that are working also in that lab, gave their children first the vaccine.
Yeah.
And then before even sending it out for other people to use.
in 2013, something actually happened. Like to in addition to what he just said, the same merchant company, they produced they produced another vaccine. That's for the human papilloma virus.
Yeah, HPV.
Exactly. Now, it's not that we all know that what happened for the Qatar virus, Qatar incident rather, is they found out live virus in the vaccine.
Yes.
It was not the case in this particular one. This one had broken glasses inside the vaccine. So imagine people seeing this kind of thing, and somebody like me, I will even raise my tongue and say, I'm not doing it again. It's enough reason for me to turn back. You understand?
Exactly, you're right.
So let's date back to what just happened recently, the COVID-19. I love that expression.
Yeah, because why I heave the sigh is because even as health workers, it was a lot. There was a lot of back and forth. There were all these experiments. Everybody was coming out with their own. This is our vaccine, and this is why it works. And then our country was trying to get vaccines from from a particular nation, and they're like, no, we can't give you our vaccine, so we have to get. So everybody was like, are you sure the nation that is giving you this vaccine are giving you the right ones? And then how this was COVID was novel. There was not enough time to do a lot of experiments. Like we have a lot of clinical trials, preclinical trials over years. Like you mentioned all this Qatar incident. If you notice, like this has happened over years. There were recalls, corrections, and also. But COVID did not give us a chance to do all those things. So it was like we're just winging it, and everybody was like, we're not going to try this. But when we saw our politicians taking the vaccine and nothing happened to them, and our senior health workers taking the vaccine, so for me, it took me a long time. Yeah,
even as a health worker.
Yeah, so I would say that, but it boils down to trust. That's just it. If we're able to trust, I think with the whole Qatar thing and everything, it's a matter of trust, and I think trust is very precious. It's something that we give the healthcare system.
Well, can I ask you a question?
Yes.
Why is it that we don't trust people? Like, why? What have people done to us that we don't trust people, for Christ's sake?
All of these incidents alone serves enough to lose trust in the system.
Right.
So that's a lot.
Why are you feeling attacked?
No. I don't feel attacked. I just feel burdened. It's different.
Right.
Yeah. So it's a lot to unpack. Like that word trust.
Yes.
Because the thing about trust is that it's earned. And then when it's lost, you have to do a lot more to earn it. Yes. And that's just coming off of relationships. Now, coming off of healthcare that can affect not just individuals, but communities and nations. There's a lot that we've not been able to do, but we are learning as we go. And the beautiful thing about it is that now we have we own up to our mistakes. We own up to our mistakes. Like, we tried, like, I think about, like, for HPVs now, we've tried so much as a nation to try to get the vaccinations for free because it was so expensive. In fact, one of the reasons why I could not get the vaccinations for so long was the cost. The vaccines have been available in developed countries, but it was so expensive to get it here. So, but it took a long time. And after a lot of series of negotiations, cross-sector collaboration, finally we had a system that now we had to now start rolling out the vaccines about a year ago. That's from 24th of October. So there's a lot. Funding, cross-sector collaboration, we're open about our research and what we find, and all the transparency in our management, building capacity of health workers. All these things can enable us to build more trust in our end users. Yes.
Yeah. So before we even go further, there's something that actually happened from the Qatar incident and then to the HPV and others. There was this particular program actually that came on board, which they saw the whole thing because vaccines were, instead of it to be solving problems, rather they were
creating more
problems. So this particular program was established. That is the National Vaccine Injury Compensation Program, the VICP. They're just like the NAFDAC of our today, right? So they made sure that most of these vaccines were screened out because before it can go in for public consumption, they have to go through that process. And they made sure that, before anybody can take the vaccine, it has to go through this process. So I think that's actually solved a lot of problems then. Yeah,
before I take any more reactions as regards what we're discussing, we're still talking about vaccine hesitancy. We're going on a short break now. Once we return, we'll come back with more issues as regards this particular topic, vaccine hesitancy. Be right back.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people. And let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in and let's drive straight into the hearts of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
Every day, amazing stories of hope and tenacity unfold across the globe. On Hued Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hued Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hued Network's YouTube channel as we embark on this journey of positive change.
Welcome back. This is still Timeline, and we're discussing vaccine hesitancy today. It's a very interesting one, very controversial, going back and forth on the table. You know, team jab or not. But wait, which are you, team jab or not?
I'm a doctor. I'm always team jab.
Okay, now let's move on now to, we're talking about recent incidents. Now, we've talked about COVID-19 already. And I think the one that is more recent to us here in Nigeria is the HPV. That's human papilloma virus, the vaccine. I understand that in communities, people have been hesitant about taking these particular vaccines. As someone in the field, what are a few of your experiences, things that you've noticed as regards the hesitance and the reasons behind it?
Oh, okay. Thank you so much for that question. So, we concluded a conference in the middle of the year, strengthening leadership for healthcare. And one of the panels we spoke about in the Medical Women Association of Nigeria was where we went wrong as pertains to the HPV vaccine. And, you know, the thing about community entry, which we spoke about before we went on the break, is that you have to go through the people they trust, right? And it's very difficult for you to not be a member of a community.
I want to bring something new to them.
Exactly, especially as it pertains to their health. Especially because this is something that they are going to be taking into their bodies.
Yes.
They are going to be definitely hesitant about it. They would not want to take it. So we discussed about how we can get everybody, not just healthcare workers, we can get community leaders as vaccine champions. We can get religious leaders, no matter their religious affinity, as vaccine champions. We can get other people who are also members of the community, maybe trusted parents. There are some people who are very influential, yes, within the community, who may not be holding official roles. Those ones are leading without titles. So we can get those people, thank you. So we can get those people on board, you know. So in the marketplace, they're speaking to their friends. In their workplace, they're speaking to their friends. Oh, my son just got the vaccine. My daughter just got the vaccine, and all that. So here in Nigeria, vaccinating girls 9 to 14 years of age, but outside outside the countries, both males and females, but here we're focusing on the girls of age 9 to 14 because it's believed that they are not yet sexually active. And the moment you're sexually active, you have more risk of exposure to the human papilloma virus, which can cause so many cancers in both sexes. But with female, it causes cervical cancer, which is one of the highest kidney cancers, even here in Nigeria. So we're just trying to get everybody on board because I think that's where we missed it. Trying to get people in the community on board.
I think this is very, very important because like there are situations, especially in these religious and cultural beliefs kind of thing. You see somebody that is, especially our girls, sorry you.
It's fine. Gender equality.
Especially our girls. You see a lady that is still very young. They'll tell you, maybe your cultural leader or your religious leader will say, don't take vaccine or you might not conceive. You know, those kind of beliefs. And of course, even though when you're pregnant, they'll say, don't take vaccine or it's either you die or your child dies and all those kind of superstitious beliefs.
So addressing that now, there are not enough studies to corroborate giving the HPV vaccine in pregnancy, right? So for now, we would not say people that are pregnant should take it, even though we don't have any study to prove or disprove the fact that the vaccine can hurt them or their fetuses. So that's why we're like, okay, for now, we can leave it out. But for now, this rollout of this vaccination program is particularly targeted at the young girls aged 9 to 14. And there have been many questions, like you raised the concern about infertility. It's not going to cause you to be infertile. The studies have shown that the HPV vaccine only helps to prevent you coming down with human papilloma virus. It doesn't affect your fertility in any other way. Then some conservative communities are worried about the fact that it's going to make their children more promiscuous. So they feel like, if they take this vaccine, it means that they're going to go out and start having sex earlier or even more. But it's not going to make your daughter more promiscuous. All it does is just to help your daughter so that whenever she, attains that state of sexual activity, she's protected from coming down with the virus.
Nigerians, show you pop here.
It's actually very interesting. But again, I want to know some of your success stories in the field where you've probably in communities where they were hesitant about taking the vaccines at first, and then they now welcome the vaccines. I remember there was a time that a family member of mine was going around for checks of all of these things. I think it was majorly on malnutrition then. And usually when they bring out their ruler and all of that, they think that there are those that want to demolish houses. So they will run away and then they will now have to go and drop that one first. And they now come to explain that, okay, this is what we want to do and all of that before they now start bringing their children out. So how has it been possible for you to conquer all of these hesitance in some communities where they are very hesitant about taking viruses?
Okay,
vaccines.
Okay, no problem. That's fine. So I don't have all the numbers, but I do know what some initiatives I've been able to pull off, like the Gavi, who are the ones supplying us the vaccines in Nigeria. They were able to do some projects in communities. They went into the schools. They got them to write essays about it. Yes, because they were also at our conference. They had a whole stand where they displayed the pictures of the winners. So they were able to talk about like just different essays that would it called on their creativity as children, and it got them talking, and not just them, because when kids are talking, their parents are involved and their teachers are involved in the conversation.
Everybody's involved.
Exactly. So it was amazing. And then not just that, we're in October now. So, this is cancer, mostly breast cancer, but cervical cancer now, awareness more. So there are lots of awareness walks all over the place now, and awareness seminars, webinars all over the place to get people to be more involved. Recently, we concluded an outreach at the Mangaza community in Lokogoma in collaboration with Medicaid Foundation. That's the Medical Ministry of Nigeria, FCT chapter. And we gave free cervical screenings to the women. And a lot of women came out, so we had, because it was a community that had mostly locals who could not understand English. So most of our resource persons had to speak to them in the language they could understand. When they explained to them, okay, this is what we're doing. So the women came out and they got the screening. But right there what really struck me was that right there in that primary healthcare center, they had a box of vaccines. The moment we told them that we're coming to do screening, they were like, oh, okay, we sent for the vaccine so that if anybody's eligible here. So you could see that they are very, very proactive about this. And it's not just Damangaza, it's all across all the primary healthcare centers in FCT where I have at least most of that information. So I think for now, what we're trying is that we're trying to get everybody involved. We go for all these outreaches, go for the awareness works, we go with people who can speak the language, who can relate to them.
That's
so
the
once you get them on board, you most likely get a lot of collaboration from them. Yes.
So again, I want to know some social cultural practices, that our belief systems that are actually affected or kept us where we are. Because I remember vividly during COVID, I'm going back to COVID now because COVID's vaccine was very popular. It was everywhere, and people were saying all sorts of COVID that, oh, don't take the vaccine, oh, it's 5G this, it's 5G that. They want to have mark of everybody, they want to have everybody's data.
They want to steal your future.
Like different kind of
You now belong to the devil.
exactly, like different kind of things, right? Like how well, like are those in public health trying to ensure that all of this information is out so that people don't just hear something from the newspaper stand and then they say, COVID-19 used to give people also
A lot of misinformation everywhere.
Like someone just say something. Probably someone even had maybe underlying conditions before taking the vaccines, and then he took the vaccine and the person there say, because of that vaccine, that's why this person died. How well are you able to like couple of this information for like
how is the journey of sensitization like?
Exactly,
Okay,
that's the word.
thank you so much. I'm going to start locally. So the Nigerian Health Watch had this misinformation management project, and they put out an article on their sites. So they did a social listening analysis. Now, the social listening is a concept where they actively identify and analyze the conversations of public health. So they try to find out what are people saying, and they listen to it, and then they get the information so that they can gain valuable insights that they can now use to now address these people's concerns and questions. And what they came up with was that they did a study from January to July 2023, and there was like a very sporadic reporting across traditional media and social media. So like in January, there was lots of articles about vaccination and everything. And then, some months it would just dip, and then other months to come back. So the thing is that what we're trying to do now, and I'm grateful to be here, is that we're trying to get on board the media. Yes. And I'm happy that you guys are having this conversation because I'm not a media personality. No, not everybody is comfortable speaking up, but we all have social media accounts. We can start from there.
Yeah.
You can post something on social media, especially if I usually encourage health workers, and this is my personal opinion, that as health professionals, to some extent, we are charged with the responsibility of public health because you know these things.
Yes.
Even if you're not a public health professional, you can share information with your neighbors, with your family members, and even with your community of social influence on your social media platforms.
Yeah.
And because you're an authority in the field, whether you're a nurse or a doctor, they would believe you.
Yeah.
Because it's coming from a professional, right? So going on social media and then having like will I say, very, very formal forums like what we're having now. Yeah. And then also the traditional media, the newspaper articles and, the TV stations and everything. Keep speaking about this and let people know in languages that they can understand. I watched a video once when I went by a shop in my place. It was a campaign video, but it was targeted to a northern population. It was like a music video. They put like their celebrities on the video. There was music, there was dancing, and there was the pictures of the aspirants.
Okay.
And it was very engaging. I don't understand a word of Hausa, but watching that video, I could put myself in the shoes of whoever is watching this video. I will vote for you because that spoke to me in a language. Music is universal.
Yes.
Then Hausa is my language and it's engaging. So let's try to bring out information and put it in a way that the public can digest it and understand it. Yes.
So I guess this thing is not just a burden on just the healthcare practitioners.
Yeah.
It's on everybody. It's on me. It's on you. It's on everybody. Literally, like we all have to get on board on this particular one.
Yes.
So let's talk about some solutions that have already been made or are in progress as well. Yeah. I know of the IA 2030. That's Immunization Agenda 2030 by WHO, which the plan is to ensure that every community has access to vaccines. They are well vaccinated to ensure that all of these diseases that we can prevent, they are well prevented from our communities. Which other programs? Do you know any of such programs that are currently on board as well?
Okay, so in Nigeria we have what we call the NPI. Yeah, so that's like the formal immunization program for Nigerians, right? We have a schedule. Now, the HPV was just recently added to our schedule as of October. Before it wasn't the HPV, it was just, the BCG.
October
24th October 2023. That's when it was rolled out, yes. So, we'll have at birth, they'll tell you, okay, you take BCG, you take hepatitis B virus vaccine. You keep stepping it up and up and up till you get, so now we've added 9 to 14 years, HPV vaccine 1 shot. Okay. So, and what we do is that all relevant regulatory bodies, right? From the Federal Ministry of Health, to the NCDC, to even our medical associations, and then of course hospital managements, and then primary healthcare facilities. They put this information out there, in their what they call it, in their formal, their formal communicate to the communities. And even in their, like, if you go to hospital lobbies, primary healthcare, you see the posters. So that even if you're not sure what to do and you come in, before you start asking the front desk officer, you can already see a poster that shows you, these are the vaccines you should be getting at this age, and this is where you can get them, and everything. And the beautiful thing about that, the ones on the NPI are free. Because one thing that has really stopped people from getting vaccinations in countries like Nigeria is costs.
What was the full meaning of NPI?
Okay, the National Program on Immunization.
Okay.
Yes. So the ones here in Nigeria, they are free.
Okay.
Yes, the ones on NPI.
Only the ones on it. Because
there are other
vaccines.
Yes.
That the amount was more than minimum wage.
All right. So basically, you've talked about health advice to your fellow health co-workers.
Yes.
So personally, your own personal recommendation, because we've gotten recommendation from CDC, they are saying that more sensitization, both from the rural to the urban areas, they should be sensitized, and there should be trust, of course, in the medical line. Yeah. So let's move to our personal recommendations. So what do you think about it? What's your personal recommendation?
Okay. And I would not say it's my personal recommendation. Okay. It's but I really, really resonate with the fact that effective communication will help us to go a long way with curbing vaccine hesitancy. And that involves active listening. And that was why I spoke about the social listening project that the Nigerian Health Watch did. So you have to listen to what people are saying. You can't just come and force things down their throats. There's a reason why they don't want it. Find out why, so that you can know exactly how to meet them exactly. If you meet them at their point of their need, they'll receive you. But if you're coming like you're doing them a favor, they're human beings. They're not going to listen to you. And then when you've been able to get that information, now you should be able to communicate to them, like I said, in a way that they will understand.
So it's
That's
more like
way they
hear
will
from them
accept it.
and then speak what they want to hear.
Exactly.
Yeah. So to add up to what you said, I feel that with effective communication, people will become vaccine confident.
Yes, they will.
Yeah. So that's just what I feel.
Well, I am vaccine confident. I'm so sure of that. Are you? That's the question that we should be asking ourselves now.
I wish I had a need to test that theory.
There's no vaccine. There's no vaccine that I know that is available that I've not collected. Even don't have to pay money for. I'm ready. Just shoot me. I don't mind.
It's not true. It's BS.
Shoot me. It's been a very interesting conversation, and I enjoyed myself. I hope you as well did. Thank you very much for coming, Dr. Blessing.
Thank you for having me. Thank you so much for having me.
Exactly. And also, my name remains Paul, and with me here is
Joe.
Thanks for watching this episode. See you next time.
Bye.
Bye.
Bye.